All right. Good afternoon, everyone. As people come in, they can join us. Thank you for joining us today for this virtual HSLC Learning Circle session. My name is Antonio Caffey, and I am the strategy lead for the Housing and Stabilization Learning cohort here at Community Solutions. Before we dive into the content today, I'd like to just remind everyone that today's session is being recorded. So if you miss anything or want to revisit any parts later, you'll have access to the recording and the slideshow presentation as well. Since we have a large number of folks today, we won't be doing individual introductions. Instead, I encourage everyone to introduce themselves in the chat. Let us know your name, organization, and where you're joining from. It's a great way to see who's in the room and foster connections as well. Let me start by giving you a quick overview of what the Housing Stabilization Learning cohort is all about. So the HSLC is an innovation cohort that's part of the Built for Zero and other communities here at Community Solutions. Essentially, we work with communities to build effective prevention systems that can catch people before they fall into homelessness. Our HSLC learning circles are peer learning opportunities that take place quarterly through virtual sessions like the one that we're having right now. We provide a space to learn about emerging tools, best practices, and innovative approaches from communities across the country. Here's our team that is working across the country to support local initiatives like Cincinnati, which we're going to hear from shortly. Great group of folks, if I may say so myself. Here's a map showing where we're currently engaged in. Richmond, Contra Costa, California, Eugene, Lane County, out in Oregon, Cincinnati, Ohio, Charlotte, Mecklenburg County, North Carolina, and Hartford, Connecticut are the 5 communities that comprise our cohorts. Just a few, just to highlight a few of our objectives today. We'll be discussing predictive analytics and how it helps forecast housing instability and prevent homelessness with a focus on Cincinnati's efforts. You're going to learn how Cincinnati's HSLC team uses predictive analytics to identify individuals and households at high risk of homelessness, and how this data informs resource allocation and service interventions. And then we're also going to discuss how Cincinnati's success with predictive analytics can be adapted and scaled to other communities as well, exploring both challenges and best practices. And we're also going to, at the end, ask you some questions. You know, is your community currently engaged in using predictive analytics for your prevention work? You know, what's working well, and what's some of the challenges that you all may have okay. So I'm going to, at this time, we're going to throw it to Tom, who's going to, Tom Albanese, who will walk us through a community-wide housing stabilization program.
Thanks, Antonio. Can you guys hear me okay?
Yep.
Okay, great. Tom Albanese, consultant working with the team. I'm based here in Columbus, Ohio. I'll just do my introductions that way versus in the chat. And just very briefly, we really want to hear from our friends from Cincinnati, but we wanted to share this. Many of you have seen this already. This is just sort of our working information infographic, as it were, that gives something of a bird's eye view of what we're all sort of aiming for, which is a full spectrum, as some of our partners call it, approach to housing insecurity, a community-wide housing stabilization approach, if you will, that coordinates efforts for people who are quote unquote upstream farther away from experiencing literal homelessness, but still housing unstable, to people who might be, sliding towards literal homelessness because they're at risk of losing housing in a defined period of time, and they don't have any other resources or viable housing options that will last very long. And so those are the dynamics that we kind of center this work around. And what we're going to hear from today, if you go to the next slide, Antonio, just briefly, we're going to hear from our amazing team in Cincinnati, and Kevin and the team will share their work around predictive analytics. We're trying to find a way to start to think about this work of sort of working upstream, if you will, to help people who aren't yet showing up at the shelter front door or aren't showing up yet at your eviction prevention program, but they may be showing up with a utility bill that's in arrears. They may be showing up at a pantry. They may be showing up anywhere in your community, and they may have a flashing red light going on that no one is seeing because they have a background, a history, characteristics, indicators of higher risk that if the utility bill isn't paid off, there's a quick series of things that are most likely or with higher probability going to happen. And so predictive analytics, in a sense, is still a targeted way to get to people who are at higher risk. Maybe we can think about this as latent risk, not manifest risk. Like, I've got an eviction notice and my mom says I can only be there for 2 nights and I've got nothing in the bank. Material risk versus latent risk. I previously was homeless with my kids. I'm really struggling month to month. I have very thin kind of family network, social network, and I now am behind on my utility again. That's where we start to get targeted and go upstream. There are some hazards around this. I just want to say, we can miss the mark. And this is where efficiency, like getting to the right people, is really important, and the learning that goes with that. It's not just like you build a model and you go. And I think that's what we're going to hear from our friends. Lastly, I'll just say this is starting to happen all around the country. Los Angeles started this work a couple of years back. A number of other communities are starting to get into this space. I know some communities are looking at Cincinnati, trying to learn from what we're going to hear about today. And that's just really exciting. And I think hopefully everyone saw just the day before yesterday, the U.S. Interagency Council released the first ever national framework to prevent homelessness. And in that framework, they talk about where kind of this type of work fits. So we might think about this as really diversion, but it's targeted diversion. We're looking to go upstream a little bit to people who are at higher risk. So with that, I'm going to pass it back to Antonio to welcome our friends from Cincinnati.
Thanks, Tom. So now, as Tom said, I'm excited to introduce our special guest, Kevin Finn, President and CEO from Strategies to End Homelessness in Cincinnati, Ohio. He's going to be sharing how they are using predictive analytics in their work.
Awesome.
Kevin?
Thanks for having me. Okay, let me see if I can share my screen again. All right, is that displaying correctly for you all?
Yep.
All right. Okay, so I'm Kevin Finn. I'm the president of Strategies to End Homelessness in Cincinnati. And what I'm going to talk to you all about today is what we refer to as the Housing Stability Collaborative, which uses predictive data analytics and proactive services paired with those to try to reduce housing loss. Full disclosure, this program went live in July, so we're not real far along. We don't have a lot of outcome data we can share yet, and that it just went live sort of a couple months ago. But first, I wanted to give you all just a little bit of information about us as an agency. So our mission is to lead a coordinated community effort to end homelessness in Greater Cincinnati. I myself started out as a street outreach worker, and what I noticed at that time was that The homeless service agencies didn't even talk to each other, much less coordinate their efforts. So I started Strategies to End Homelessness in 2007 to do that system coordination piece. And then we've sort of grown from there. Our tagline is prevent, assist, solve, because those are the three buckets that our work falls in. So we try to prevent as many people from becoming homeless as possible. We try to provide a high level of assistance to people who are already homeless so they can get back into housing. And we offer solutions to homelessness through housing. So, those are the three buckets of our work. To throw out some terminology that everybody is probably familiar with that'll also sort of help you understand who we are. We are the COC lead agency for Cincinnati, Hamilton County. We are also the HMIS lead agency for our area. We are one of the 14 or so unified funding agency COCs. So we actually manage all of the COC funding on behalf of HUD, do all the monitoring and compliance and all that work. We also administer the ESG and HOPWA funding, which are other pots of HUD funding, as well as state, county, city, and some private dollars, all targeted toward homeless services. Jamie Hummer, who is our program director, is also on the call today, and I'd invite Jamie to jump in as she sees fit. What falls under Jamie, among many other things, is we also run the coordinated entry system in Cincinnati, Hamilton County, which includes a centralized shelter intake function, obviously the housing match process for moving people into our COC-funded housing projects. And then we also make referrals into the Housing Choice Voucher Program in partnership with our local public housing authority. And then sort of a little more generically, like we're in charge of prevention services. So we oversee the shelter diversion services that are available in Hamilton County. We don't do a lot in the emergency rental assistance space, but then pre that emergency rental assistance space is where this housing stability collaborative work falls that I'm going to go into more in just a second. So those are sort of the roles that we occupy in Cincinnati, Hamilton County. So we had this idea, I think like a lot of communities, we'd had this idea of, was there a way to use predictive data analytics to reduce the number of people who lose their housing? So we had been sort of kicking around, if we could do that, what would it look like for some time? And then maybe, unlike a lot of communities, a very specific opportunity to begin doing this work came along for us. So in 2023, the city of Cincinnati set aside funding a little over $2 million. They called this funding opportunity the Impact Award. And it was over $2.1 million in funding to go toward one project that the city of Cincinnati thought would have the greatest potential to reduce evictions and housing loss within the city of Cincinnati. So we were one of multiple organizations locally that applied for that funding, and we were lucky enough to get it. So the Housing Stability Collaborative is the effort for which we applied for that funding. And we applied with multiple partners within our community to undertake this effort together. So our partner agencies are listed here. I'm going to run through them real quick just so you know what their roles are. So Bethany House is our largest family shelter provider. They also do shelter diversion, rapid rehousing, and permanent supportive housing for families and aftercare. Found House is a smaller family shelter provider, but they also do rapid rehousing and permanent supportive housing. Lighthouse is our youth-focused organization, people under the age of 25. They're our YHDP lead organization. They do COC-funded rapid rehousing, permanent supportive housing. They also do street outreach to youth. The YWCA is our domestic violence provider, so they do shelter and housing programs specifically for DV victims. St. Vincent de Paul is not a COC-funded agency, but they're one of those large multi-service agencies where people in our community go for everything from their charitable pharmacy to emergency rental assistance. Legal Aid Society, I think most people are familiar with what they do, but their role in this project is a little different. So I'll get to that in a minute. But their role in this project is not intended to be at the courthouse. It's supposed to be significantly earlier than that. Then probably our two most unique partners in this effort, 8451 is a data analytics company based here in Cincinnati. They do data analytics for the Kroger company, which is also based here in Cincinnati. And they have been working with us to analyze our HMIS data for over 7 years. And then Flywheel Social Enterprise Hub is, just as the name indicates, they are a social enterprise hub that helps surface new ideas for how to affect social issues. So those are our partners. The concept that we all collectively pitched when we applied for this funding from the city is this: to use predictive data analytics to identify households in the very early stages of a housing crisis. And we basically defined early stages of a housing crisis as pre-eviction notice. But we're trying to identify these households even before they necessarily realize that their situation could lead to them losing their housing. And then we want to proactively contact them and reach out to them and offer assistance to resolve their situation. So that is what we propose to do. I will mention, just because it popped into my head right now, again, City of Cincinnati is the funder. So for this, while most of our work is Hamilton County, this particular project is specifically focused in the City of Cincinnati. And a condition of the funding was that this is all families. So this program is for families that have at least one dependent child in the household. But this is the concept that we put forward. My slide here is not as fancy as the one Tom was just talking about, but this is basically the exact same information, just in a different format. So if you go from the bottom to the top, you know, the homeless services system, the COC funding, the ESG funding is basically targeted at people who are already literally homeless. We have shelter diversion services that Jamie also oversees for us at Strategies that are really targeted at people who are doubled up. And those are things that fall squarely under us at Strategies to End Homelessness. Then obviously most communities have someone that is doing imminent risk where people have an eviction notice in their hand or even considering abandoning their housing because they're behind on their rent. We're not so active sort of in that space. This Housing Stability Collaborative is a new layer to our system that we're basically designing from scratch, and it is for those at-risk households that, you know, they may be scraping the dollars together to pay the rent, but as a result, they're not paying other bills. They may be getting disconnect notices on their utilities. They're going to food pantries to get food so that they can make ends meet, those sorts of things. So that at-risk layer where there were not previously any services available, at least not in our community, is really what is being targeted by the Housing Stability Collaborative. Why target it that way? To me, there are 3 different reasons why we wanted to do this. So again, if you start at the bottom of this table that I have here and go up, you know, in Cincinnati, Hamilton County, every person who becomes homeless is basically a cost of just over $4,700 per person to our homeless services system, which is a pretty expensive intervention. Meanwhile, depending on what services they get, whether or not they get matched to a COC funded housing program and this, that, and the other, our success rate in helping them is somewhere between 22% and 36%. So there's still a significant number of people that, even though they became literally homeless and we assist them and we spend a lot of money on them, there's still a relatively large percentage of people who become homeless again. Whereas if you go one step further up the ladder to our shelter diversion program, which catches people when they're doubled up, the cost goes down to about $1,600 per person. And we are 95% effective in keeping them out of future homelessness. Then the next line up in purple, these numbers are from St. Vincent de Paul, which in non-COVID times is our biggest provider of emergency rental assistance. If you go up to the point where people have the eviction notice in their hands, St. Vincent de Paul spends anywhere from $300 to $800 per person helping people, and they're 90% successful. And then above that is this new strategy we're implementing for people who are at risk. We don't know yet what the cost per person will be or the effectiveness will be, but what we're hoping for and anticipating is that similar to these other services, the costs will get lower and the outcomes will be better by intervening earlier. So that is what we're shooting for. And oh, by the way, we're saving people the trauma of becoming homeless. So, again, we're targeting families here. So, if we can identify people and prevent them from getting evicted, the average kid, when they lose their housing and they become doubled up, they change schools multiple times, their education goes to hell. They experience so many different forms of trauma. If we can head that all off, we save those children and those families all of that additional trauma. So the reduced costs, the better outcomes, reducing trauma, those are the reasons why we thought this was the right thing to do. So how we moved forward. We were picked to get that city funding and handed the opportunity to do this thing we'd been wanting to do basically in the summer of 2023 for a number of reasons that involved bureaucracy at the city of Cincinnati and this, that, and the other. We ended up basically planning for this effort from August of last year through June of this year. The first thing that we did was we pulled together 3 committees to oversee this work. The first is a leadership committee comprised of the executive directors and key staff from all of our partners. But then we pulled together a data committee whose job it was to be looking at and identifying data sources that would have a predictive value of people losing their housing and evaluating the predictive value of the different data sets that were available to figure out which ones we should use, how they should be weighted, all that sort of thing. We also convened a service delivery team because remember, we wanted to proactively reach out to these households and offer them assistance. And that's a new service delivery model. So we needed to plan for how we were going to offer services and what the service delivery was going to look like, and what the outreach to the families was going to look like. Because again, we're looking to catch people before they asked for anything. So we're cold calling people in various forms to reach them to see if they want some assistance. So and that's a very different service delivery model and way of engaging with households than we have in any of our other projects. So I think the 2 big parts that I'm going to talk about a little bit separately of moving this forward is one is the data search and the data analysis, and the other is the service delivery. So those were 2 simultaneous tracks that we needed to move down. So first, I'll talk a little bit about the data side. So we began last summer pursuing over 25 different data sets that we thought potentially had predictive value in identifying who was going to lose their housing or get an eviction notice. And then what we knew we would do is, the data that we were able to get our hands on would be used to develop a predictive data model to essentially rank those families based on their likelihood of receiving an eviction notice. So the list of families that the predictive data model generates for us operates a little bit like a priority list that you might have in your coordinated entry system or something like that. We begin reaching out to the households. We really only look at the households in the top quintile of all the ones that we've identified, and that's who we begin reaching out to. The data that we're using is updated regularly, like it's refreshed regularly, but we can only bring completely new data sets into the data model periodically. So while the data gets updated regularly, new data sets are coming in roughly every 3 months. So we were planning for a July 1 start. So the sort of 1.0 version of our predictive data model is what we went live with in July. We have continued to pursue additional data during the subsequent months. And in October, we're going to roll out a 2.0 version of the predictive data model. And then we'll continue chasing more data, with the idea being that whatever we land in the next 3 months will be incorporated into the data model come January, and so on. So that's sort of the way we have been moving forward, and we continue to chase many a data set to inform this process. But a couple other things to be thinking of, I'll get to what some of the data sources are in a little bit. We needed a place to land all this data. Like, we needed a data system where we were going to be able to bring all this data together. And basically what we needed that system to do is to be able to land data from multiple sources, match households across multiple data sources. Because again, we are not doing, this is not, in aggregate. We're drilling down to the individual household. So we need to be able to match households across multiple data sets so that we can identify the ones at greatest risk of getting an eviction. So the data system we landed on is called Client Insight. It was built by Ecovia. Ecovia does operate an HMIS system, but this is not their HMIS system. We, in fact, don't use their HMIS system in our community. Client Insight is a separate product that works as a data lake, and that's the one that we decided to use. We also did at least one other thing. Some data just doesn't exist, so you have to do some things to create data in the absence of data. So we worked with Flywheel Social Enterprise Hub on a 2-part event that was in January and February of this year, the Housing Stabilization Hackathon, where we convened a group of, technologically minded people, entrepreneurs, all sorts of people, not the crowd we normally hang out with. And we did a hackathon to try to surface some new ideas for how to improve this project. And the winning concept is something called Tenant Guard, or tenantguard.org is the website. You're all sitting there at a computer, so if in a separate window you want to open it up, you can check it out. Tenant Guard does multiple things for us that were all issues in this project, or we had identified as issues in this project. So it solves 3 problems. One, we knew we were going to have issues about having good contact information for these households. It's one thing to identify them, it's another thing to be able to reach them. So one of the things Tenant Guard does for us is if we can get a family there, they can provide us updated contact information for their household. They also can consent to services and to data sharing through the website. But I think really the big thing is self-report. Like, we knew we needed an option where people who they themselves regarded their housing as being somewhat at risk could tell us about their situation. So the main purpose of tenantguard.org is it is a survey asking people information about their housing situation. And hey, while you're at it, sign a consent and give us your updated email address and phone number and that sort of thing to help us better be able to reach people. The version of Tenant Guard that is up and running right now that you might be looking at is a 1.0 version. The second version, which is still being built, is going to use artificial intelligence to give people suggestions on resources in the community that they might want to reach out to if they didn't already know about them, because we're anticipating we're going to get a lot more people going to the website than this project is going to be able to help. So it was important to us that people start getting information back that would be helpful to them. So that AI chatbot part of it is not built yet, but that's still in the works. But we wanted to go ahead and start getting the contact information, the consent forms, the survey information. So Tenant Guard is creating new data where it didn't exist. I think that's the most sort of important thing to understand about it. In order to pull this off, there have been several sort of key partnerships on the data side, a couple of which I've mentioned, a couple of which I haven't. So Flywheel did the hackathon with us that came up with the Tenant Guard concept. 8451, again, has been helping us with data analytics for over 7 years. And it actually was a group of 8451 staff that pitched the Tenant Guard idea that was the winner in the hackathon. And they are helping us build that chatbot that uses AI. Another key partnership was building and updating the predictive data model. So we partnered with Dr. Gary Painter, who is at the University of Cincinnati. He had previously been in the Los Angeles area and had been involved in the work being done in Los Angeles, which is a little different than what we're doing. But he told me he wasn't really sure how he ended up at the University of Cincinnati. And I told him, I know exactly why you're here, because I have a lot of work for you to do. So he and his students have actually built the predictive data model for us and are updating it for us every 3 months or so. We are also working with, I'm not sure how many people are familiar with LEO, but the Lab for Economic Opportunity at Notre Dame, as a part of their economics department, they do research on human services interventions to document their effectiveness. They are going forward helping us with research design on this project, which I think will help improve it in a number of ways. And then they're going to begin studying this project sometime next year. So these are some key partnerships that we've had on the data side related to this project. So let's talk about the data sources we're using. I'll be perfectly honest with you and say that I was a little disappointed in how many and which data sets we were able to land in time to go live July 1st. But the flip side of being a little disappointed about that is that I'm very excited about some of the data that we're going to be bringing in the 2.0 version and 3.0 version. So we went live with a predictive data model that's basically built off of these data sets here. So we had both city and county COVID ERA funds data, so people who had been behind on their rent in the last few years. We run something called the Central Access Point, which is a helpline that is also a part of our coordinated entry system. We're using data on people that have been in contact with the Central Access Point. We are using our HMIS data so that we can flag households that had been homeless in the past. We have data going back about 12 years, so we can see if a household was in the system anywhere in that time. Data from our shelter diversion program. We are scraping county clerk of courts eviction data off of their website. I mention it that way because that data is not always easy to get, but if you can build a scraper that pulls it down off the website, you can get it. And we are also using data from St. Vincent de Paul, which again is a large multi-service agency locally. So we're getting data from them on people who came into them for everything from box fans to bus tokens to rental assistance. So people who are, showing up as experiencing instability in a couple different ways. Now, next month in October, we're going to roll out the 2.0 version of our predictive data model. So these are some of the data sets that we will be incorporating next month. So we have been working with our public housing authority around sharing data with us. They're the biggest landlord in the county. They're the biggest evictor in the county. So they're providing 2 data sets to us. One is new applicants for subsidized housing. So data on people who came to them and applied for housing as perhaps an indicator that their current housing is on the rocks, kind of thing. So that's one of the data sets. The second data set they're sharing with us is something I have no idea if different PHAs use the same terminology, something they call 30-day notice no response, which is a list they generate every month of people who are behind on their rent, but have not been given an eviction notice yet. So maybe they're not sufficiently behind on their rent to generate the eviction notice, but they are behind. So getting that from the largest evictor in the county should hopefully be helpful to us. We are using multifamily property sales data from the multiple listing service as well. So we will be able to see, we've looked at that data, and people in a multifamily property that is sold have a much higher rate, at least in Cincinnati, of getting evicted within 6 months afterward. So we are getting that MLS data on multifamily property sales. We're actually getting it at the point that properties are listed for sale as an indicator that the households in those properties could be at risk. The Free Store Food Bank is another really big multi-service agency here in Cincinnati where people go in for food, rental assistance, all kinds of stuff. They added a consent to their intake process, and they have begun sharing data with us. And that'll be a really good one for contact information and that sort of thing as well. And then the tenantguard.org website information will be incorporated into the data model as a separate data set in the 2.0 version. We're already using that to skim out contact information that we need, but we're actually going to incorporate that data into the predictive data model in the 2.0 version. And then to give you an idea of some of the other data that we're chasing, or at least the categories that it falls into, we're working on getting data through the Ohio Department of Job and Family Services about people who applied for new public benefits or got cut off of public benefits. Could be unemployment, could be SNAP, whatever the case may be. We've been trying to get utility data around people who got disconnect notices. Not necessarily that they got disconnected, but that they at least got a notice. Legal aid helpline data. There are a lot of people who call legal aid, but they're not far enough along in the process to actually have an eviction notice. So we want to get a hold of the data on who called them. They are currently referring people to the Tenant Guard website, though, so that functions somewhat as a workaround, that if entities that can't yet figure out a way to share data with us, if they at least point people to that website, then effectively we get those people's data in a different way. Same thing with 211. People who get locked up in our county jail, that is public record information. And obviously, if people get locked up and miss even a few days at work, that could cost them their job and head them down the path toward instability. That's public record data. We're working on getting that. There are some other multi-service agencies we're trying to get data from: the domestic violence hotline, food pantries. We're also doing, mostly we're trying to drill down to the individual household, like by name, but we are also looking at a number of things that would help us identify hot spots in terms of areas. So we are also trying to inform our process with, does somebody live in a neighborhood that has a higher eviction rate? Are they in a zip code that has a higher eviction rate? Those sorts of things. And similar to that would be other risk factors that perhaps we can identify from the data itself as we go forward. So this just to give you an idea of the type of data sets we're pursuing. And again, we're updating the predictive data model every 3 months. Okay, so that's the data side. Now let's talk about the service delivery side. So the data analysis generates a priority list, kind of like a coordinated entry system. And then we are sharing the information we have about those households with 3 of our partner agencies, and they are beginning to outreach to those households. The outreach looks a little different depending on what contact information we have, because if they are identified in a data set that includes a phone number, great. Some of the other data might have an email address. Some of the data might only include a street address. So what the outreach looks like to the household varies a little bit depending on what we have in terms of contact information. And we've sort of set up the service delivery as having two tiers to it. So every household that is identified is eligible and wants to participate in the program, is assessed, and then they are assigned a system navigator. So we have 3 agencies that are doing the system navigation. The reason we call them system navigators is because we're really hoping that for a large percentage of these families, since they don't have an eviction notice in hand, that we might just be connecting them to resources that are already available, but that they just weren't aware of, or something like that. So Bethany House, Found House, and Lighthouse are each carrying a caseload of families, and providing system navigation services. Sometimes when they get into working with the families and they figure out more what their situation is, those families may need services that go beyond system navigation. So the second tier of services is legal aid in St. Vincent de Paul. So I mentioned before that legal aid's role is a little bit different in this project than what most people think of. We're trying to not have people ever get an eviction notice. So what legal aid's involvement is going to be going forward is around like negotiating issues with landlords, dealing with fair housing issues, addressing, people who maybe they're at risk because they were inappropriately cut off of some sort of benefits or assistance. They have an employment issue and therefore haven't been working. But ultimately, we're not going to be 100% successful in keeping people from at least getting an eviction notice. So obviously, legal aid will be working with people who do get an eviction notice as well. The second agency that is functioning as a second tier of service is St. Vincent de Paul, because they can provide wraparound services that the system navigators can't necessarily provide. They can do food, they can do pharmacy, and we do have a modest budget for emergency rental assistance connected to this project. Our key partnership on the service delivery side has been Cincinnati Children's Hospital Medical Center. We partnered with a doctor named Carly Riley, who's a part of the service delivery team, and she helped us develop the assessment we're using with these families, which is inclusive of many social determinants of health. So we're not just talking with the families about, it's not just rent. Like, we're trying to look at the whole picture of what the family needs that has led to them being unstable, and having Carly involved in helping assess all those needs has been very helpful to us. Outcomes that we are hoping to achieve with this. Some of these might sound a little funny to you all, but there were also certain things that the city was looking for in terms of this project, and I think these are all accurate for what we're trying to do. Trying to reduce evictions for families and children, show that earlier intervention reduces the chances of eviction and reduces trauma, as I was talking about before. Reducing community costs associated with eviction, that these preventative services are way more effective and cost effective than waiting until people are homeless. Maximizing our limited housing supply. There's a certain amount of turnover. People losing their housing and units turning over creates not only instability for those households, but it also creates a certain amount of vacancy as units are not available. There's not a family currently in them, and they're not yet rented up to another family. So reducing turnovers and vacancies, the legal aid component of helping people get needed repairs and things like that so they can stay in the unit they're in rather than having to move on. And our thought is that all of these things combined create a better quality of life for residents in all of our neighborhoods. So having a stable resident base that is, their kids are staying in the schools, they're employed in the neighborhood, all those sorts of things are good not only for the families, but they're good for the community in general. So in terms of outcomes, those are the things that we're looking at. Here you're looking at one of my standard slides that I put into almost every PowerPoint I ever do. You know, everybody talks about homelessness is going through the roof. The numbers are way, way up, this, that, and the other. We try to really focus on prevention. So this is homelessness in Cincinnati, Hamilton County, an unduplicated count. This is 2013 through 2023. And I think compared to what some communities have seen across the country, it's pretty good. You know, we were down for 3 years during the pandemic, and we saw a 1.5% increase in 2023. I think that our focus on prevention is a part of why these numbers look better than maybe they do for some communities. And that's all I got. So I'm happy to take whatever questions people might have or anything like that.
Kevin, thank you so much. This was a great presentation and a lot of great information that you gave out. So questions, there's a lot of information, a lot of useful information, a lot of interesting information. So if you have any questions, please feel free to ask them. You can use the react button, raise your hands, and we'll see if we can, and just go ahead and unmute yourself and go ahead and ask.
Hi,
Mary.
can I ask a question?
Oh, I'm sorry. Yep, go ahead. And Mary, I got you.
I'm just curious, when those in your community could also already be facing an eviction and looking for things like rental assistance, how do you deal with allocating funds towards people further upstream when there may be people already with evictions who aren't getting rental assistance?
Well, you know, that, as I mentioned earlier, I think that's where we got a little bit lucky. I think the hardest thing about, we knew we wanted to do this for a long time, but like, how are you going to find the money to do it for just exactly the reason you're describing? You know, like there's so many good ways that these dollars could be used. We are benefiting from the fact that the city of Cincinnati decided to set aside $2.1 million to do something new and innovative. We didn't have to carve the money away from emergency rental assistance programs or anything like that. The city of Cincinnati had already done it. To be perfectly honest, though, my hope is to never have to go back to the city to ask for renewal funding. Because, you know, like we have technology companies that are considering funding this effort. Like we have entities that are looking at potentially supporting this work that would never write a check to a homeless shelter or a sort of same old type intervention. So, you know, my hope is that if we can prove that, if we can make this work and prove that it works, that we can bring new dollars to the table to reduce homelessness. And then maybe those dollars that the city put toward this type of project one time could go back to emergency rental assistance programs or something like that. But they certainly have given us the opportunity to try something new or different. And I'm not sure we would have been able to get it off the ground if our city council hadn't made that decision.
All right. I see Mary. Go ahead.
Yeah, I was gonna, thanks for your presentation. Amazing, and super jealous of where you're at and hope that we can get there in our community as well. I was wondering if you have any other eligibility criteria for the program other than they have to be a family with minor children. I think in our community locally, we get very stuck on AMI. So it's like, yeah, they might appear on this list, but are they below 30% AMI, or are they between 30 and 50 because we only want to serve groups in that way? Like, have you put any limitations on the eligibility criteria like that, or funding require that?
You know, we have not, but, you know, Jamie Hummer will sit there and laugh at me to say, like, I'm not the detail person at Strategies. I don't think the contract from the city had any restrictions on it other than it's got to be families and they got to live in the city. I don't think we're applying an AMI criteria specifically, but I don't know off the top of my head. So Jamie, do you have any idea?
Sure, but I don't believe so.
I don't believe so. You know, to be perfectly honest, there are more restrictions on this than I want. You know, single individuals make up over 60% of our homeless population. We're not allowed to serve them in this project. And everything else we do is at least Hamilton County, if not greater Cincinnati. So even having this be restricted to city, like administratively, that has proven to be a real pain in the butt. Just, you know, the amount of time we're wasting verifying that somebody is a city resident before we reach out to them, it's a waste of time. So to some extent, those two restrictions, city and family, might not sound very restrictive, but I think they are.
Kate and then Tom.
Hi, thank you. Yeah, I'm just wondering what your caseload size is for the tier 1 service delivery.
So this is a complete shot in the dark. So again, we only went live in July. So our best guess was caseloads of 20 to 25, but that we would be working with families for an average of 3 months. Personally, Kevin Finn, I think 3 months is too long. I think maybe this will prove to be, by engaging with households earlier, that we work with them for 2 weeks or a month, and we've connected them to the resources they need, and we're done. But we don't know. So like, there's some very big things about the service delivery. What is an appropriate and comfortable caseload size? How often will the caseload turn over? What will be the average length of stay? All that stuff. We literally are just beginning to figure that out right now. But what we were sort of spitballing was 3 months, 20 to 25 per caseload.
And how many folks do you have working right now?
I'll be very honest with you all. The ramp up has been slow. So not all of our partner agencies had all of their staffing in place July 1. 2 of the agencies didn't get their full-time service navigators in place until earlier this month. And the contact information issue has been a huge problem. We've only been able to reach about 20% of the households we tried to reach. And then of that 20%, only about half of them were still appropriate for the service. And some of them, the situation had already resolved and things like that. So the caseloads at this point are still relatively small. I think we have a handful of families enrolled with each case manager at this point, because we've had such difficulty in just reaching people. That's part of the reason why I'm so optimistic about rolling out the 2.0 version of the data model next month, because it is going to include several new data sets that have much better contact information in them than the ones we're using right now. So hoping that our take up rate will improve when we get to the 2.0 version of the model.
And is there anything? Yeah, no, that's great. And is there anything you would share as oh, I wish I would have known this when I started, to somebody who's looking to pick up a project like this?
We are already, so the dynamic we started with was, we're identifying the families we want to serve, and then we're giving a list of them to each of the 3 frontline service or tier 1 agencies, and they are doing the outreach to the families. What we have already noticed is that meant the outreach looked very different. There's 3 different versions of the outreach, and some agencies were doing it better than others, and that was affecting the uptake rate. So what we're already considering doing is centralizing the outreach with one entity, so that we know every single person is being contacted in the same way, being approached the same way. The service possibility is being described to them in the same way. The goals of why we're reaching out to them are being described the same way, as opposed to having 3 different ways of trying to engage people. So that's the first thing that sort of jumps to mind. The second thing I would mention, if I was doing it over again, would be paying attention to which data sets have the best contact information in them, because, we sort of pursued 25 different data sets all equally. If I could do it again, I would go back and focus on the ones that were longest on contact information, or most likely to have more recent contact information or something like that, so that, again, we could reach families at a higher rate.
All right, we have
I'm sure I'll
Tom.
think of some other things that I would do differently.
I'm sure you know that. We have Tom. Then we're going to go to a few questions in the chat, and then Rachel, I see you.
Sure, I'll be brief. Kevin, I'm just curious. I love the what you presented and just the direction you guys are going. I'm curious about how you're evaluating outcomes and how you're defining success, and thinking about like how you presented it, and looking at the cost down the ladder, how they grow, the costs grow down that ladder, but those numbers shrink too down that ladder as well. So I'm wondering, like, how are you is the impact or the outcome that you're measuring just to help somebody avoid going down one step of the ladder to the eviction notice, the need for, more costly intervention? Or are you also measuring how many of these folks kind of up that at the top of that ladder, upstream, if you will, are also having some positive success with regard to future literal homelessness? And is there a control group kind of methodology there that you're considering with your Notre Dame folks?
Well, our number one goal is, we're looking at all of these. The first would be no eviction notice. Second would be no eviction. And we have the data to measure all these, so no eviction. Then, a third point would be, our coordinated entry system and the CAP helpline. People tell us what their housing situation is when they call CAP. So we will eventually also be able to see, like, how many of these families still got an eviction notice, how many of them still got evicted, how many of them later called the CAP line and reported that they were now doubled up, those sorts of things. And then obviously, as the HMIS lead agency, we'll be able to see if they actually enter the homeless system later. So those are all things that we will be able to measure. So, I'm hoping that we'll be able to see our success with all those things, and we'll be able to compare not only how many of these, what percentage of these households still got an eviction notice versus a control group. We'd also be able to do the same thing for how many later were literally homeless. That's a part of the design of the research study that we're doing with Leo right now. And a second reason why we're looking at centralizing the outreach is because that's where we would eventually be able to start randomizing.
Right.
When you have 3 different entities doing outreach to families, it would then be harder to figure out, which people that consent go into the control group versus the service delivery group. So another reason to have that all happen in one place would be so that we can do a controlled sample and look at it that way.
And just to say one more thing, I think, to put a finer point on it, like, it's all the above. Like, the benefit of early intervention, in terms of the secondary results, are all the above. And you're going to have a smaller cohort who might end up reaching, who would have gone all the way down that ladder, and probably a much larger cohort who's going to hit the next layer that's much more costly. But that's really fascinating.
Well, and for me personally, so we have Leo at Notre Dame beginning a study on our shelter diversion program next month. And then we're going to have them starting to study this program next year, both prevention programs. My personal goal is to take those 2 studies and go to Washington, D.C. and beat HUD over the head with them, to allow HUD, so that they will let us use some of the funding for prevention in a way that is difficult to do now. So anyway, that's, I would love to just have the flexibility to use a little piece of our COC funding for something like this. Not even necessarily ask them for more money, just ask them to give us some flexibility to do this sort of thing with the funding that they're already giving us. I wouldn't literally beat them over the head with, but whatever.
Look, we'd understand though if you did. So we have a few questions that we want to get to in the chat. Thanks again to those folks that are posting it. One question, and we hear this anytime you talk about data and sharing data between agencies. You know, we understand that can be a challenge. So one of the questions, what are some of your challenges integrating the data across systems? For example, you know, there's scraping data from court website, assuming you don't have social security number or other IDs.
You know, another thing, I think it was Kate or somebody who asked the question before, like, what would you do differently? Getting consents in place early. Like, we probably would have much better data if some of these organizations, if we had them ask clients to start signing a consent for this like last September, then by the time we got to July and we were going live, we could have had a really strong data set from some of them. But some of them we didn't even think about it. So like actually some of the data sets that are coming online next month fall in that category where we finally got a consent put in place, and the data they're going to be sharing with us is everybody who has signed the consent since they put it in place, kind of thing. So that's another thing I would do differently. But it also, Antonio, it's one of those things, like I wish we had done that earlier, because there are lots of organizations for which you're just never going to get around. You have to have a consent to do this, you know, like legal aid and a DV agency, and you know, some of those, like, you're just never ever going to get there unless you build in a consent. And the sooner you do that, even way back before you actually start doing the data analytics, the more data you would have to use.
All right. And there are two questions. I'm going to actually combine them.
Oh, hold on. I knew I was forgetting something I was going to say. The other thing is think outside the box of what is out there. So like the jail data that we're going to be bringing in, that's public record data. And what we figured out is one of the mental health system agencies locally gets a list every day from the jail of people who got locked up, and they get it so that they can see if any of their mental health clients are currently in the jail. So they were already generating this list. So the easiest data source we ever came across is that one, because all we had to do is, hey, could you copy us on that email that you send out every day already? And that one was a piece of cake. Another great example, I think, the multiple listing service data about properties that have sold. That has proven to be highly valuable data. My brother's a realtor. His team exports that from MLS and sends it to us. So I'm literally getting data from my brother that is helping inform this process. So we definitely have to think outside the box in terms of ways that you can reach data and get to data, because the more you think about it, you'll think about lots of creative ways that you can get to things that have value.
Indeed. Next question. With $2 million, I think you may have touched on this, but with $2 million, how many households do you estimate to help? Can you go into a budget breakdown?
We're estimating 120 households per year, but that's just take the 3 caseloads of 20 people. I'm sorry, 240 a year. That's just that same math I mentioned before. Caseload of 60 at any moment in time, 3 months, so it turns over 4 times. You know, like that's just how we arrived at it. We don't actually know yet what the number will be, because especially the length of stay, we just don't know how long households are going to stay on a caseload. So if it ends up being less than 3 months that we're serving families, then that 240 that number will go up significantly. If for some reason we had to stay active with families for 4, 5, 6 months, that number would actually go down.
Okay. And one more question. Well, before, and I know there are a few more. I'm going to ask, like, would it be possible, and this wasn't a question, but I'm asking, would it be possible for you to put maybe your email address here? So if someone has a question that we may not have gotten to today, or they may think, you know, think of one later on.
I'm sorry, I skipped the chat introduction part because I
Oh,
was
no.
going to be talking so much already, but I'll do that right now.
Okay, thanks. Last question, and then Rachel, I'm coming to you. How was Tenant Guard advertised so that people trust it and are willing to take the survey?
You know, that has also been a bit of an issue. First of all, it's only been out there since last month. So we've only had a month to sort of get it out there. We have one of the big entities that wanted to see Tenant Guard go live was our local apartment association. Because we had a lot of conversations with the apartment, you know, a couple landlords said to me, well, if you want to know who's at risk of getting evicted, ask the landlord, kind of thing. But, you know, property owners can't just share data about their tenants. You know, that wouldn't be ethical to do. So another advantage to the Tenant Guard website was that the property owners themselves wanted something that they could post in their buildings, post in their rental offices, and different things like that, that would steer their tenants toward connecting with this initiative, but without the property owner having to share data about their tenants. So that is one way it has been promoted, has been through the property owners themselves. I also mentioned that, you know, some of these entities like Legal Aid and the DV hotline, and some of them who we have not been able to figure out a way yet, at least, that they could directly share data with us. They are sharing Tenant Guard with people who they're communicating with and referring people there as sort of a side door to getting those people connected to what we're trying to do. All of the partners involved have been, you know, we've done canned social media posts and all sorts of stuff like that, that all the partners have been sharing on their media. We've asked them to put it on their websites if people go to their websites seeking resources, you know, all that kind of stuff. So those are the ways that we've promoted it. With sort of mixed success so far. Again, it's only been up for about a month, and there's still an upgraded version of that website coming. So we maybe haven't done the sort of full court press on getting it out there as much yet as we will when the 2.0 version that has the chatbot and the AI is ready to go. But that's what we've done so far.
All right, thanks. And Rachel.
Thanks, Antonio. And thanks so much, Kevin. Sorry, I'll let Lauren in real quick. And thank you, Kate. I loved your questions and took copious notes. I guess I've got actually a twofer. So one involves kind of your by name list maintenance, kind of how you have kind of set up rules around how that list works, and how you're kind of managing with those referrals going out to the different agencies, kind of pre, and then we'll see maybe post kind of centralizing that kind of further assessment process. That's kind of a question maybe for you, Kevin and Jamie, the list maintenance. But then I also have kind of a broader question for the community here of just kind of curious like how this tool and approach kind of lands in communities. We've talked a little bit about challenges, but I'm curious kind of what next steps, if anyone wants to come off mute, like what next steps you all may see for your specific communities.
You want me to go first? All right. Again, we've been way too reliant on the contact information thing. So, you know, we have been focusing on the top quintile of people on the list. I mean, we originally generated a list of 14,000 households and then, you know, honed it down from there. You know, once we limited to city of Cincinnati, dependent child in the household, this, that, and the other, we got down to more like 200 households. And the reason I mentioned that we are overly reliant on the contact information is then we had to look at those households and see which ones do we even have a means of contacting. So in some instances, perhaps a household that the predictive data model did not think was quite as high risk, they're the ones that got contacted simply because we had a way to reach them and we didn't have a way to reach a household further up the list. So Again, the contact information issue has been huge. I'd have to enlist my data analytics director and a couple people smarter than me to answer that question in more detail than that.
Right. And then Rachel, your second part of your question for the group, can you say that again?
Yeah, I noticed in getting a chance to spend time in, Charlotte and Hartford and Contra Costa, and yeah, obviously with Cincinnati, folks are in kind of different stages of, trying out tools, thinking through kind of targeted populations. But I'm wondering, we've talked a little bit about challenges thus far around consenting, contact information, centralizing a process, but I'm kind of curious what folks' kind of takeaways are from this conversation. What elements do you see kind of landing? What successes or hopes might folks have, and then maybe what challenges do folks maybe anticipate?
And if there's something you think we just didn't do it the way you think we should have done it, you could feel free to share that as well.
Thank you, Kevin.
All right.
I'll be brave and come off. I'm from Contra Costa County out in California, and this is super interesting. We're very interested in exploring how to integrate data, predictive data models. We're working on updating our screening tool with the hopes of bringing in data. We're housed in the public health sector, so very, very interested in that. I think for us out here in the Bay Area, we are struggling to keep our prevention programs afloat, like standard prevention. When I think about this and how many families would make that list and how to outreach them, the volume just like gives me anxiety on how to manage that. So I love this program. It's so interesting. For me in this conversation, I definitely feel overwhelmed of like, how can we bring something like that here? Because I agree, the upstream prevention is the way. Getting ahead of people's problems really supports our communities from ever getting to that point. But yeah, I'm so excited to bring this back to my team to start to think about how can we start to move from prevention to upstream prevention to really get it. So those are the challenges and the hurdles I see, but hearing these stories are super inspiring. So coming to these community sessions is super inspiring. Thank you for hosting them.
Thank you. Other comments regarding predictive analytics in your area?
Yeah, I had a question in the chat. I guess I'll just ask it here then. So what's factors are actually influencing your model and like driving people to the top of the list? Is it, like a previous homeless episode or like food stamp receipt or previous evictions? Like what is in your model that's, driving the list and putting people at the top?
Well, little too complicated for me. So each of the different data sets our data team and Dr. Painter at UC looked at separately to see just how strong of a predictive value it had. And then the predictive data model weights, the different data sets differently. So according to the predictive value. So not every hit in one of those data sets, so to speak, is equal. Some of them have greater weight than others. To be honest, I can't tell you off the top of my head which ones have the greatest weight. I believe that the primary is people who go to St. Vincent de Paul for particular services, but they provide a whole variety of services, and I'm not sure which ones were the highest, but I could certainly get you an answer to that question if you want to send me an email. But off the top of my head, I'm not actually sure which ones have the highest weight and which have the lowest weight.
And you're really trying to predict the homelessness or eviction?
Eviction.
You're trying to predict eviction?
Yes.
Okay.
We're going to monitor, the outcomes in terms of not just eviction, but homelessness and that sort of thing. But what the predictive model is built for is to predict receipt of an eviction notice.
All right. All right. Kevin, thanks again. with a presentation, taking the questions, got a lot of, you can tell, and you can, if you've been in a meeting lately, you know, I'm sure you've heard the term predictive analytics and how it's and AI and how it can be, you know, we hear some negative things about AI, of course, but just how predictive analytics, it's really taking shape when you talk about prevention and coordinated prevention and really, you know, trying to, as someone said, you know, get further upstream and based on certain factors, you know, offer that assistance before folks enter into a homeless crisis. So again, thanks, Kevin. And his email is in the chat. And I'm sure he's open to any questions or anything, just shooting him a message.
Absolutely.
Right.
Thanks for having me.
No, thank you. All right. So like I said, before we wrap up, you know, I wanted to remind everyone of our HSLC online hub. Platform provides access to various community resources, our HSLC tool bank, and past workshop recordings. You can also sign up for future learning circle sessions directly from the hub. You know, so we really look at it as a valuable open source resource for ongoing education, training, and engagement. To access it, you know, just want to click on, you can either use this QR code right here. I believe Rachel has either already or will be putting the link into the chat for you to use. But if you go to our website, community.solutions, you click on that community login, it's going to take you to another page, and you're going to see a link where it says hubs. Click that, it's a little drop down menu, and then you'll see HSLC hub. Just click that and you'll be good to go. Oops, I'm sorry. I was actually going to give you a brief tutorial, but never mind. Modern technology. All right. So this, and some folks asked that question too. Just FYI, this presentation will be on our hub. We're going to put this presentation, the recording, as well as the presentation will be going on our hub as well. Hopefully we can get that up next week. So like I said, once you click on there, you know, we have a wealth of information that's contained on there for you to use. So please feel free to share that. And, you know, if you have any questions, definitely get in contact with us. So I want to thank you all for being with us today. I had my email address up there, but it's not showing. But if you want to contact me, my contact information is actually on the hub. But if you want to email me, my email address is acaffey, C-A-F as in Frank, F as in Frank, E-Y, at community.solutions. That's acaffey at community.solutions. But also, if you want to go to our hub, you'll find our contact information on there as well. So again, thank you for attending today's session. Look forward to seeing you in future Learning Circle sessions. And again, thank you all for continuing to do the work to prevent homelessness in our communities. Take care.